Well, let's talk about what's going on with you and your back. What are you feeling? I can see on the MRI, and we're going to go over it, there are some significant structural problems. But from your point of view, and I saw when you walked in here, you're having a lot of trouble walking.
Yeah.
What kind of problems are you having?
Well, it started out a couple of years ago when I noticed a pain. We haven't had anybody look at it really. So it's gotten much, much worse recently. That's what you saw.
Yeah.
I used to be able to walk fine, but it hurt, and now it hurts. It starts in my lower back, right about here.
Yeah.
And it goes all the way down my leg.
Right.
And it's very difficult to walk.
It feels like electricity?
No, it just feels pain. Just a pain. Yeah.
In the ankle too.
And in the ankle, it goes down to the ankle, and there's kind of electricity in the ankle, maybe. Yeah.
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 Is it the inside of your ankle or the outside of your ankle?
It's both.
It's both. When you walk, do you feel like you're going to lose power in your legs? If you just stand up, do you feel like you're going to lose power?
Yeah. What happens is my legs buckle.
Yeah.
And the more I walk, the worse it gets. But it's what happens when it's bad. Like in the evenings, I can't stand up very long because when I do, my legs just want to go down like that. You know.
Yeah.
I kind of lower. I kind of lower myself down, and I don't want to. You know. But
have you had any falls?
yes.
Yeah. Tell me about them.
Well, the first one I had was in Pine Top, and we were up there, and I got up and I fell over a table. I turned. Mostly what happens is when I'm turning, that's when the problems occur.
Yeah.
And I turned around the sofa, and there was a lamp on a stand, and I knocked that over and fell down.
So if we didn't have this back problem, from what I hear, you're
We'd
ready.
be on a cruise.
You're ready to cruise.
Yeah.
You're ready to start a new
Yeah.
life.
Right.
I'm ready.
Yeah. Yeah. Wonderful. Okay. Well, that sounds like a good goal to me, actually, to go on a cruise. Well, let's talk about the spine and the other things that can interfere with surgery. Short of breath, have had some stents. We have to look into that. How old are you now?
I'm 77.
No,
78?
you just turned 78.
78.
Just turned
September.
78 in September,
turned
so just a
78.
couple months ago. And what about memory? A lot of guys, as they are coming up on 80, start having memory issues.
I do.
That
I
is
am.
an issue?
Yes.
Okay, do you mind if I talk to her? Because
Sure.
generally people
No.
don't know. How bad is it? Is he knows where he is? What's going on?
Some days are really good, and some days he's not in the present. Like the paper today, he thought it was 2019, 20. He didn't
Okay.
he didn't even hit 21.
Right.
So it just some days are good and some days are not.
No,
And then ask me.
I have always had short-term memory problems. Going through school was very hard with me,
Yeah.
and going through college was even worse. So
Yeah.
that's always been one of my issues, but you know,
It's
sometimes
worse now.
Yeah.
Yeah.
He
Right.
falls at least once a day.
Yes. Yes. Well, normal pressure hydrocephalus is
Right, that's what he has.
ataxia, which he definitely has from his gait that we saw. And we'll see if the great test is they drain that fluid out, and if your gait improves enormously while it's drained, then you might be a good candidate, if the surgeon says so, for a shunt. 1 in 200 Americans has a shunt.
Wow.
You don't know which one of your neighbors has one, but one of them does.
Wow.
So it's a very common thing.
I didn't even know what a shunt was.
No.
It doesn't get a lot of press, does it? Incontinence is one of something which usually goes with that, which you're not having, which is fantastic that it's not happening on your spine level as well. Let me show you your MRI of your spine, if I could,
Yeah,
and
please.
give you a sense of what's going on there. But as we go down through your spine, we get to an area here. no fluid.
So is the fluid good or bad?
Fluid is good. Fluid is
Oh.
how these nerve roots get their oxygen. It diffuses in through this fluid. And compression is bad. Okay, cowboy. They always say this looks like a steer.
Yeah.
I don't know if it does to you or
Yeah,
not.
it does.
Yeah. Well, it's not supposed to be a steer. It's supposed to be,
Like that.
yeah. So your steer part of your spine is where it's narrowed. And the medical term for that narrowing is stenosis, narrowing. So you have a severely stenotic spine. And the reason you're stenotic is because there's been a little bit of a shift in the bones. The walls of the spinal canal are the joints. And I mean, you know, I don't know about you, but my joints are getting bigger as I get older. So those walls are getting bigger naturally, they're moving in. And then the roof of the spinal canal is a ligament called the ligamentum flavum. Well, that ligament's getting thicker because of the use with age. Roof's coming down, walls moving in, the bulging disc. The disc is the floor of the spinal canal. If we were in this room and the floor was coming up and the roof was coming down and the walls were coming in, it's getting narrow. That's what's happening in your spine. It never reverses itself. This narrowing, which doctors call stenosis, it never gets better on its own. And if you left it alone for long enough, it would cause you to lose your gait, lose control of your bowel and bladder, you'd be unable to maintain an erection, you'd lose sexual function, and ultimately you'd have urinary tract infections. So this is not something you can live with. It's something that's got to be fixed.
Both the narrowing of the canal and how that impinges on the nerves that come down through there. Is that what you're saying?
Yeah. The narrowing of the spinal canal, the stenosis, because the roof of that canal is this bone called the lamina, and in medicine, if we take something off, if we raise the roof, it's an ectomy. So the operation that does that is called laminectomy.
Oh, yeah.
Laminectomy. Super common operation. In fact, one of the most common operations in America. There are minimally invasive ways to do it today that really are very safe, very effective. It can be done as an outpatient. You don't have to go into the hospital. It's really, really fantastic operation. Now, I don't know, it seems like everything with you is a little bit complicated. Nothing's quite simple. There's a slight shift in the bones, and sometimes we'll have you get x-rays where you bend forward and backwards. Sometimes that slight shift is not stable, and in addition to doing a laminectomy, a surgeon would recommend a fusion operation to lock the bones together.
Oh, really?
May or may not be necessary in you. There's a lot of really good studies that show that the outcome of people with a slight shift is the same with fusion plus laminectomy compared to fusion alone. The problem with fusion is once they go in there and weaken the spine to do the fusion, we often see problems above or below. So you'll hear people talk about, oh, I had a fusion, then I had to have another one, then I had to have another one. You don't want that.
No.
The other problem with fusion is it's a lot more surgery. Everything you've told me about the normal pressure hydrocephalus has to come first.
Right.
It's not safe to put you under anesthesia for your lumbar surgery, your low back surgery, while you're going through this process with the normal pressure hydrocephalus.
Doctor, thank you so much. This has been weighing on him that they think he has an ulcer now over this because he's wanted surgery, he's wanted anything that would help him for almost 2 years.
Yeah,
Before he even was this bad.
right.
And you're telling him that we have to wait is a good thing. He needs to understand that.
If your hydrocephalus, the brain fluid problem, is not treated, then back surgery is not an option.
Yeah.
If your hydrocephalus is treatable and you can get that pressure under control, then the back surgery is a no-brainer.
Right.
Okay.
And the question will be, who's going to do it? There are people at Barrow, there are guys in our community. You'll have a lot of options.
Okay.
But the first thing is to get this lumbar puncture test done and see how you walk. And I'm very excited to see the results.
I ask you a question.
Yeah, of course.
Is what has happened to me physically, did my horse riding and falling off horses and all that stuff have a lot to do with that?
No,
Oh, it didn't?
no.
Oh, really?
Wow.
Yeah, horseback riding I've seen so many broken necks from horseback riding. I've seen wear and tear in the lumbar spine. But the thing that causes the hydrocephalus, absolutely nothing to do with the microtrauma of horseback riding. In the low back, the cause of this is an overly mobile joint that had to constrict, so it's arthritis. For all we know, maintaining the core strength to stay on a horse and staying active is what helped you get this far despite the severe narrowing.
Oh, really?
So I don't believe it had anything to do with it. It wouldn't matter if it did. We can't undo
Yeah, you're just
what's
looking
been
at
done.
what has happened.
Yeah, but for all we know, it helped.
Okay.
And so I would just say, just put it away.
Okay. Okay. Thank you.
Well, in medicine, we have a rule. There's no, we call it the parsimony of diagnosis. We want to find one problem. Another way of referring to it is there's no ticks and fleas. You've either got ticks or fleas. You got ticks and fleas. you got this brain issue, the normal pressure hydrocephalus, which needs to be worked out. That's the ticks. And then you've got the spinal stenosis. That's the fleas. But most of the time you have two different problems, both of which have excellent treatments and really solid things you can do. And you've taken the bull by the horns and you're getting it done. So I commend you for that. You're otherwise pretty healthy except for a little coronary disease. And I'm sure we'll get some pulmonary testing done.
But I smoked for about 20 years, I guess it was. And
Cigars or cigarettes?
both.
No, 20 years with cigars, maybe 2 years.
Maybe 2 years, yeah.
Oh, you just came off the cigarettes.
Yeah. Well, I was trying to be a cowboy.
Yeah,
No kidding.
the Marlboro
Cute.
man.
Yeah, the Marlboro man. I've got
what
a
happened to
picture of the
him.
Marlboro man in my shop in the garage. That cartoon not cartoon.
Yeah.
Advertisement
Yeah.
that you used to tear out of the books.
Yeah.
I have that there. So
But that's not the goal anymore. The goal now is to get on that cruise. If I
yes, it is.
Absolutely.
Is to get on that
Yes,
cruise.
it is.
Where are we going? If all
Yes, it
this
is.
works out.
Back to
If
Italy.
she's happy, I'm happy.
All right. Well, we're going to see what happens.
Okay.
Next step is to get that lumbar puncture. The other thing I would do, if I would advise you, is I would pick a cruise in the spring
Seriously?
as a goal. Yeah.
Okay.
As
All
a
right.
goal. Okay. Well, I would start thinking about a cruise that's not too hard, just to give them a little light at the end of the tunnel.
You're right.
Well, and then spine surgery once you're recovered from that. So that would be February, March.
Yeah, I'm thinking
So
February.
then cruise April, May. And so
Okay.
given the summer, maybe, I said the spring, I think I might have jumped the gun. Maybe early summer, get out of
Okay.
Phoenix when it's so hot. Deal?
I'm going for it.
It was really nice to meet you guys.
Thank you so
I'm excited
much.
for you. You've got a road ahead of you. You got ticks and fleas, but you can do it. Cowboy up.
Cowboy.
You can
Yeah,
make
that's
you
it.
can make it through.
Yeah.
Yeah.
Thank you.
You're welcome.
Thank you.
You are welcome.